And stories like this certainly have lots of people checking their hands, and we should be checking lots of other body parts as well, right? We are here to discuss with Dr. Theo Nyame from Charlotte Plastic Surgery. And when we are looking, you know, you're supposed to do the yearly check, right, with your dermatologist. What are you looking for if you're just checking your own skin for sun damage?
So sun damage obviously can lead to skin cancer. In the United States, almost 1 in 5 people will actually develop some form of skin cancer. When you're actually checking for the skin, you should be looking for changes in molds. If you had a mold that has been the same size and all of a sudden has increased in size, or a change in color, that's one of the signs that you should seek professional help in order to determine whether this could be a melanoma or a skin cancer.
Okay, let's talk prevention first. If you want to help it from happening at all in the beginning, of course we're talking sunscreens and sunblocks. What are the key words we need to look for as far as ingredients, and what's the difference between those two?
This is very confusing for a lot of people.
Yeah.
So there are two general categories, a sunblock and a sunscreen. The sunblock blocks out almost all of the sun's harmful radiations. It's actually a physical barrier that keeps most of that from damaging the skin. A sunscreen, like a screen in a window, lets some of the radiation in, but blocks out most of the harmful ones.
So why would you ever use a sunscreen instead of a sunblock?
Well, a sunblock has certain chemicals that then cause a pale look to the skin, and so a lot of people, for comfort reasons, prefer a sunscreen which may not discolor the skin. However, the sunscreen is not as effective, and so in most studies, when we've looked at it, people only get about 20% of what's actually recommended by using a sunscreen. So the key there is to reapply frequently, at least every 2 hours, and to make sure that the SPF, which is the sun protection factor, a measure of how much of that bad radiation is kept out, is high enough.
Well, for people like myself who have already done some damage years ago, you know, lifeguarding in high school, etc., and you do already have sun damage, freckles, and other things that you can see that has, you know, been done over the years, what can you do now? Are there things that you can do to alleviate that, to make those appear better?
So a lot of people have evidence of sun damage that they're not aware of. You know, when you look at your skin, it looks almost flawless. But we have...
Dr. Theo, you're just saying that.
We have techniques at Charlotte Plastic Surgery, such as the Visia, that can expose sun damage. And when you look at a lot of the sunspots...
Oh, look at that. I had one of those done. It's disturbing to see how, right, what it's done to your skin.
You know, despite the skin itself looking flawless, there's evidence of damage. There are two unique therapies that we offer at Charlotte Plastic Surgery that can be used to reduce a lot of these sunspots. The first is something called BBL, or Broadband Light Therapy. This uses intense pulses of light to heat up the skin. By heating up the skin, you can then regenerate a lot of the collagen that's been lost.
Wow, that's dramatic improvement.
And actually, exactly, reduce a lot of the sunspots that are visible. The other option that we have is something called a halo laser. Halo combines the best elements of two different types of lasers. And by causing small amounts of damage, it allows the skin to regenerate, restores a lot of the collagen, reduces a lot of the fine lines and wrinkles, and reduces some of the sunspots. Real
quick before you go, is that just aesthetic improvement, or is it actually improving, I mean, are those types of things, is it sort of erasing concerns about skin cancer for those spots too?
You know, skin cancer can develop, and what we've seen is that the effects are cumulative. So however much time you've been exposed, that increases your likelihood of getting skin cancer. By using some of these therapies, you can essentially reduce some of the sunspots. Some of these sunspots can then subsequently later on be precursors for skin cancer. And so although the studies haven't been done, theoretically could reduce your likelihood of getting skin cancer as well.
Dr. Theo Nyame with Charlotte Plastic Surgery, we appreciate the time. Thanks for coming in.
Thank you so much for having me.
We'll be right back after the break.